'Tis you must go, I must abide. So fare thee well when autumn's in the meadow.
MJHS received a grant from the New York State Department of Health that was implemented over a 3-year period at Shorefront and Menorah. It was meant to measure the effects of music therapy on agitation, wandering, and depression for people with dementia.
Or in shadow. Oh, Danny boy, oh, Danny boy, I love you so. Some of the goals for the program include addressing the reduction of agitation and depression and anxiety in residents with mid-stage dementia. There are 6 music-assisted caregiving protocols. There are 3 group-based protocols, which are sing-along, tonal, music and movement, and there are 3 individual-based protocols called range of motion, music-assisted bath or shower, and music-assisted wound care.
Music has the ability to be processed and appreciated and enjoyed by people of all stages of dementia. And the limitations that words have are really surpassed by what music can do because of the fact that the areas of the brain that process music are preserved till the very end of life. When you provide music for Nicholas, he becomes overjoyed and he sings and he remembers his life as a young person and remembers how happy he is to have music.
My dad played the piano. My sisters and brothers all played the piano. I was the one finger man on the piano. Used to play by ear and even strum a guitar, but it was by ear. All I knew was the C chord on the but we always had music.
Everyone can relate to music on any level. Even if you cannot speak, you can listen to music. It can radiate in you in some type of way to alter how you feel and how you behave.
Whatever will be, will be. The future's not ours to see.
Sophie and Viola, when you do music therapy with both, they would like get so light up and feel so good, and they would be enjoying the music and singing along, shaking the tambourine at times and playing the instrument.
The role of the music therapist is to be able to educate and present our knowledge of music therapy to the caregiving and nursing staff in a very simple and streamlined way, to be able to take certain principles that we use in our everyday practice and translate them into applicable protocols for the CNAs to use.
We found that the residents who participated in music therapy were significantly, and by that I mean statistically significantly, as well as substantively significantly, less depressed and less agitated. And we can actually see that it's a big enough difference to be visible on a graph. Of course, it's also visible to anyone watching them.
I've heard the CNAs talk about the residents who've had music therapy. They now say this person who never went to bingo now goes to bingo. They're more social, they're happier, they're less depressed, they're less agitated. It really helps the CNA and the other residents around them have a better living environment.
When we take a look at the CNAs who are working with the music therapy program, we find that there is an increase in their productivity and there are substantial changes with their attitudes, in particular with the residents that they work with. Although they know these residents and they've worked with them before, it gives them the opportunity to have some insight into what the residents have enjoyed in their previous time before Menorah, and it helps the CNAs to understand those residents better, and they can have an ongoing relationship to a much higher degree than they've had before.
Never gone, as we traveled on.
Since the music, Marilyn has really opened up, and she would talk about her 3 boys, her husband that passed away. She would tell me the good and the bad. She had sad times and she had happy times.
Won't forget, can't regret what I did for love.
Every patient can benefit from it, and the staff benefit. They go home feeling better. They come back tomorrow looking forward to it, thinking about ways that they can use these music instruments in different ways, to play something for them, to do something that involves the resident using their hands. It can help with range of motion. It helps the residents in a holistic way.
When you're agitated and when you're angry or upset or whatever the emotion or the feeling is, it lends itself to a resident or a patient possibly falling or having an incident of some sort with a negative impact. The music allows them to be in a calm state and therefore decreases those types of things from happening.
It takes less time to care for a resident who is calm and relaxed than one who is agitated. So from this perspective, you would achieve some efficiencies in care delivery. In addition, it's a more positive experience for your staff member, which contributes to staff retention, which is very important in our facilities.
Having music-assisted caregiving as part of the CNA's overall experience decreases the chances for their compassion to burn out, decreases the chances for them to be frustrated with their work when there's something such as music to supplement what I'm sure can be very strenuous daily living activities such as bathing or wound care.
There are great financial benefits from the program because there is a very low cost associated with implementation and operation of the program. It's simply training of the staff and the provision of music for those residents.
It's something that can easily be incorporated into schedules and activities and caregiving procedures that already exist. And that's the great thing about having something such as an iPod available, is that it's very easy to set up.
Most people place their relatives in nursing homes reluctantly. And so, coming to visit is often very difficult. And many people, as a result, come to visit their relatives infrequently, if at all. So I can see that this intervention might have multiple benefits that we hadn't planned on in the first place, because if the intervention makes people happier, which it seems to, makes the residents happier and less depressed and less agitated, then when their relatives come to visit, they have an interaction with a happier, less agitated person. And so they are more likely to visit more frequently.
It really does work. It's really impactful. It will really change the relationship that the resident and or patient has with their loved ones, with the staff, and with themselves.
Amazing grace, how
I find that it is a great relief to the residents who have dementia to be in music, to be experiencing music, and especially the music that they love and know, because it is a space in which they're not struggling to find the words.
Was blind, but now I see.